This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association, Watch Wisconsin Eye on Spectrum Channels 995 and 363, and at wisi.org.
On the faith community's support for Governor Evers and the Department of Health Services' recent order to reduce our capacity in our public spaces. Even though that order has now been stayed, we hope that it will go into effect. And we have representatives here from the faith community and the medical community to talk to us today about the primary importance of saving lives. So we have faith leaders from a variety of different faith traditions to speak to us today about the faith support for staying safe and staying home. I'd like to start by introducing Reverend Sonja Ingebritsen. Reverend Ingebritsen is the pastor at Community of Hope United Church of Christ here in Madison. Reverend Ingebritsen.
Thank you, Bonnie, and thank you all for being here this morning. As we know, this coronavirus pandemic is raging through our state. Our healthcare systems are under stress. Nearly 160,000 among us have contracted COVID-19. Nearly 1,600 have died, leaving loved ones and whole communities grieving. Black and brown residents of our state are at especially high risk, a compounding of health inequities due to racism. Scientists and public health officials have told us how to control the spread of the disease. Wear masks, socially distance, avoid crowds, especially indoors, and stay home to the degree possible. But not enough of us are taking these precautions seriously, leading to our present crisis. It will take all of us working together to reverse the course of this disease. This is a time to ask, what is best for our communities? What does it mean to love our neighbor? Faith communities are uniquely positioned to ask these questions, both of ourselves and of our fellow Wisconsinites. Faith traditions, although distinct, share important commonalities. Among these is the imperative for the well-being of others. And some version of the Golden Rule exists across our writings, which places inherent and equal value in every human life. In my own Christian tradition, when Jesus is asked which of the commandments is most important, he answers, to love God with one's whole being and to love one's neighbor as oneself. Friends, this pandemic is preying on our neighbors, especially the most vulnerable among us. People of faith must speak out and take action. The most significant step faith communities can take to stop the spread of COVID-19 is to restrict attendance at indoor religious gatherings or avoid them altogether. Doing so is a sacred expression of love. Despite some of the rhetoric, religious liberty is not threatened by health mandates to limit indoor gatherings, require masks, or socially distance. In fact, many of our faith communities have found this to be a time of deepening spirituality, making more intentional connections, discovering new ways of worshiping and meeting with technology, and strengthening commitments to service and justice. I won't pretend that these measures we've taken have been easy, but we understand that they are necessary. We faith leaders are here this morning because our calling is to care for our neighbor, each neighbor, and especially those at greatest risk. We affirm our willingness to comply with all measures necessary to stop the spread of this disease and the incident of death due to coronavirus. Further, many faith communities, my own included, voluntarily commit to alternative ways of gathering until it is safe to regather in our sanctuaries again. We urge the legislature and public officials at every level to take immediate steps to mitigate this crisis. And we encourage all others in the state, our neighbors, to take care of their neighbors. Public health is not a partisan issue or a personal one, but a moral one. In the end, we are all bound together for the welfare of our state. I want to thank Reverend Kerry Parker and Rabbi Bonnie Margulis for pulling this event together, and for those faith leaders who have signed on to our pledge. And with that, I'd like to pass the microphone on to Rabbi Bonnie to introduce Reverend Willie Brisco. Thank you.
Thank you. So next we will hear from Reverend Willie Brisco, who is the president of Wisdom. Reverend Brisco.
Thank you very much. And I am more than delighted to be here this morning to lend my voice to this very important subject. This year has been a tremendous strain on the entire planet because what we are facing is worldwide and it is personal also. We have a worldwide pandemic as well as racial justice being put on the front burner of our society. And I think that with a shutdown of the world economy and a shutdown of schools, churches, God has given us a chance to look at how we worship, what we worship, and how we care for each other. We have a grand opportunity now to come together and to fight against a common enemy. But somehow we have learned to put ourselves before this. We have learned to put racist bias before this. And we have learned to think of ourselves as individuals and not as wholes. And that is dangerous. I, for one, have suffered tremendously personally because of this pandemic. I have watched an aunt die over the phone. I could not be there by her side. I have seen 10 personal friends perish where I couldn't attend their funerals, I couldn't be near their side, I couldn't even be near their families. So this is personal. When you look at what we're doing in this state, we're choosing party over praise. We're choosing to finances over life. And that is somehow going against our moral fabric as human beings. We have become a society and we've become a humanity by taking care of the least of those in our care, our elderly and our young. But all of a sudden, somehow, they have become expendable. They have become disposable. As long as I have 2 cars and 2 chickens in my pot, 2 cars in my garage, I am happy. No matter what happens to my neighbor, that is against the golden rule. That is against God's commandments. And that is against what we see as humanity. There is no constitutional right for you to live and somebody else to die. There is no law that is made for me and not for everyone. We must get a hold of this pandemic by treating our neighbor as ourselves, by working according to the golden rule, and we must instill some humanity in our government, because this is where it starts. If we don't have a national plan, then we don't have a local plan. The national plan is to let everybody decide for themselves what's best for them. Well, that's not the way God planned it. That's not the way we were made as human beings. I was made for you, and you were made for me. And I can't exist without you, and you can't exist without me. So if we are going to get a hold of this, and if we are going to add some humanity back into our government and into our lives, we have to wear masks, socially distance, and respect everybody's right to life, because that's what this is: a right to live, a right to exist, and a right to be a human being on this planet. God put us here for each other, and we have got to take up that mantle and make sure that we are living for each other, and make sure that everything that we do is not for ourselves, it's for someone else and for our neighbors. I didn't write any of this down. I felt that it would be better if I spoke from the heart. So if I'm rambling, God understands what I'm trying to say. And if you understand it, God bless you, because I love each and every one of you. I love this country. I love this world. And I will go down fighting for my neighbor and giving him the right to live as I live. Thank you, and thank you for inviting me on this panel.
Thank you so much, Reverend Brisco. Now I'd like to introduce Janan Najib, President of the Muslim Women's Coalition and Director of the Islamic Resource Center in Milwaukee. Janan, you're on mute.
I'm sorry. We're still working on that. Thank you, Rabbi Bonnie, and thank you, Reverend Brisco, for your words. You can preach at any time. Thank you, Reverend Kerry Parker, for also inviting us. This is a very important event today. It is rather sad that we have to be here to confirm that the sanctity of life is more important than everything else. I really doubt that there is a faith on earth that does not place the sanctity of life above all other concerns. God says in the Holy Quran, the Muslim scripture, be patient and firm in suffering, adversity, and times of panic. These are the people of faith, the God-heeding. Sometimes affliction inevitably comes our way. The Quran teaches Muslims to see life's difficult circumstances as a test. They are temporary hardships to strengthen us. Such a perspective allows us to show resilience in times of hardship and tribulation. It's an opportunity to reevaluate our lives and the purpose for our creation. The fact that this pandemic has touched every country on earth, whether rich or poor, in every corner, in every city, should be cause for us to come together and unite in our common humanity. We can always make up for missed social events and gatherings. Businesses and livelihoods can be rebuilt. It happens during wars and natural disasters. Even a school year can be repeated, but you can never replace your child or your parent, nor can you replace someone else's child or their parent. Social distancing, wearing of masks, washing hands, and staying home unless necessary to leave is not a matter of personal choice. It's an ethical duty. As people of faith, we know our personal desires take second place to the welfare of humanity. We know that entitlement and arrogance are not attributes of the faithful. The vulnerable have an ethical claim on all of us to promote their well-being. We trust in God, yes, but God demands reason and common sense. Listen to our medical experts. Use this opportunity to help others if you can. COVID-19 is a threat to all of us, and very few will remain untouched. We must accept that we are all in this together. This is a war. In a war, would we consider that some lives are more important than others? We are one human family, and we need to be in solidarity and hold each other accountable. The Muslim community joins the pledge to do everything in our power to keep ourselves, our families, our neighbors, our fellow citizens, and even those we do not know safe. This is a shared fight, and we will emerge as a more resilient society. Thank you.
Thank you so much. Now I'd like to introduce Rabbi Renee Bauer. Rabbi Bauer is the Director of Chaplaincy and Outreach at Jewish Social Services here in Madison.
Morning, and thank you for having me. Torah tells us to choose life, and one of the most basic principles in Jewish law is that human life comes first. Almost any religious commandment can be broken in order to save the life of a human being. If we can break the laws of Sabbath to save a life, we certainly can refrain from going to restaurants or crowded gatherings. All over this country, synagogues are holding services virtually in order to uphold the principle of saving a life, the principle of pikuach nefesh. It is a religious obligation to follow the restrictions that will get this virus under control in our state. As a community chaplain in the Jewish community, I have witnessed the heartbreaking effects of this pandemic on the elderly and the ill in our community, no matter whether they live in senior living facilities or live in their own homes. And I'm not talking about clients getting COVID-19, but of living with the side effects of this long-lasting pandemic. Take Kathy, whose funeral I officiated a couple months ago. Kathy was an elderly woman who was determined to live in her home, so she hired home health aides as her health became more frail. When the pandemic hit, she became completely isolated from her community. I, as her rabbi, could not safely visit her at home. Her daughter in Chicago stopped visiting to protect her mother's health and was not able to as closely oversee her care. The aide seems to have taken advantage of her. Her health declined. Her daughter is sure that the quarantine shortened her life. Kathy is a casualty of COVID, even though she never contracted the virus. Then there's Anita, who's a Holocaust survivor with severe dementia. She's a woman who's joyful and full of laughter, but often confused about reality. Her daughter here in Madison used to visit her in memory care every day. Once the pandemic hit, she could not visit her anymore. Anita does not understand the pandemic or why her daughter stopped visiting. Anita, who's no longer able to communicate by phone or iPad, only connects through in-person visits. Eventually, mother and daughter could have window visits, which didn't work so well with someone with dementia who can't hear well. And then this summer, they had some outdoor visits. But as the outside visits end with the season, Anita will once again be alone, unable to communicate with family or have family present to advocate for her when she's unable to communicate her own needs. And lastly, there's Harry, a man in his 40s who was intubated in the ICU in the hospital, obviously unable to communicate. I sat with his family, a mother, father, 2 children, and a fiance, as they met with his doctor, who asked them to make life and death decisions about his life without allowing them into the hospital to visit. And then the doctor suggested that only 2 family members could go see him before he may take his last breath. So the 5 of them had to choose which 2 got to see him. Although necessary to protect the health of the patients, this situation seemed to me to border on cruelty and was heartbreaking to witness. Touch, love, and presence are essential parts of healing and health. Members of our community who are unable to communicate by phone or through computer need their loved ones with them. The longer citizens of our state ignore the public health guidelines, more of our elders and frail family members will be collateral damage of this pandemic. I urge each of us to take the faithful action of following public health guidelines so that we can bring families and communities together again to take care of each other. Thank you.
Thank you, Renee. Next, we will hear from Dr. Mushir Hassan. Dr. Hassan is the Vice President of Medical Affairs at Ascension Elmbrook Memorial Hospital in Brookfield.
Thank you, Rabbi Bonnie. As Rabbi Bonnie mentioned, I am a hospital leader who's been dealing with how to run a hospital in the midst of a pandemic. We want to first and foremost thank our healthcare workers for really honoring their inner drive and spirit to help take care of folks during this time of personal risk as well as great stress. I think it's very important to emphasize what my colleagues have already emphasized. We know the pathway forward to stay safe. The pathway forward is for us to be careful about masking, careful about social distancing, careful about hand washing, and really limiting our indoor contacts when at all possible. With that in mind, given my experience at the hospital, I was also able to help frame what our reopen strategy should be for the mosques, both in Milwaukee as well as a consultant for our statewide coalition of mosques in Wisconsin. And it was very clear that the safety of our communities was a priority while still being sensitive to the data that we have about how disease spread is doing in our state. We must recognize that right now is a critical time for each of us to step up and really take action to protect our neighbors. As my faith leaders have already very nicely mentioned, it's upon each of us in our service to our neighbors, in our service to our community, to take smart actions to be able to protect those as this pandemic curve continues to rise. It's very important that we do this right now. I think it's important to also recognize that if we don't do this from a healthcare standpoint, the other concern that I have is that we're going to have broad populations limiting and delaying their care that they need for other conditions. And that's going to have ramifications for us as a population health standpoint as a community. And we need to really recognize that that's going to be an important issue for us to address. So the more that we can work together right now, the better it will be for our overall community health. And that's a concern that I think as a hospital leader, I need to share with our group. I've been blessed to also have some leadership role in my own faith community, but I think it's important as a hospital leader to really emphasize that we as a hospital systems, we stand ready to help take care of our neighbors, our friends, and our families should the need arise. But we need everyone to help do preventive care right now. And that preventive care is masking, social distancing, careful hand washing, and limiting indoor interactions. I'll yield the floor back to you, Reverend Kerry.
Thank you. I'm now introducing Reverend Kerry Parker, Executive Director of Wisconsin Council of Churches.
Thank you, Bonnie. I'm Reverend Kerry Parker, the Executive Director of the Wisconsin Council of Churches, a network connecting 2,000 churches from 20 different Christian traditions in the state of Wisconsin. All year, the Council's been providing resources to faith leaders in Wisconsin so they can continue to care for their faith communities amid the pandemic. The faith leaders of our state are proactive. When COVID cases hadn't yet reached us, we were already answering questions about how to adapt gatherings to slow the spread. Clergy began choosing to go digital with their efforts in mid-March to protect their congregants, even before safer at home. Pastors, priests, rabbis, and imams want to do right by their community, to keep people safe, to serve well. We're faithful people, seeking the counsel of science as well as our higher power. I've spent countless hours on video conferences interpreting public health issues to faith leaders and the faith community context to public health professionals, all so we can lead our congregations in the safest ways possible, worshiping and learning and serving our communities despite COVID. All these long months of the pandemic, we've built relationships with each other, shared new models of religious leadership, and prayed mighty prayers. Even so, we've watched partisan battles take precedence over reasoned debate, and armchair experts shout over those with decades of experience. This hyper-polarized environment hurts us all. With no statewide public health protections available, we've had to rely on individual choices, individual responsibility, and individual behavior. The rapid increase in COVID numbers shows us that this has not achieved a desirable outcome. Wisconsin is now an epicenter of the spread of coronavirus. Those who work in medical fields are weary, crying out for relief. In parts of the state, hospital beds are full. The families of more than 1,500 Wisconsinites are grieving their loved ones lost to COVID. People are facing lifelong health consequences. Others live in fear, in isolation, as Rabbi Renee told us. Others with reduced income, because we're acting as individuals and not as a community where we have responsibility and care for one another. We come to you today as faith leaders to say that enough is enough. We who hold life sacred must do what science and wisdom teach us. Over 200 faith leaders from around Wisconsin, Christians, Buddhists, Muslims, Jews, and others, serving in houses of worship, in mental health care, at long-term care facilities and hospitals, working at faith-based camps, in regional offices and faith-based nonprofits, have united to steward the health of all by prioritizing remote activities until the crisis is past. COVID-19 is not going to get itself under control. It's up to us, each one of us, persons of faith, faith leaders, business owners, policymakers, where we are able to do our duty in ways that limit the risk of spreading COVID, to save lives and to relieve the strain on the health system. We have a moral imperative to do so. We call on the people of Wisconsin to join us. Thank you.
Thank you, Kerry. Sorry, I'm trying to stop video. I'd like to open it now for Q&A from our participants. Sorry, Kerry, I took you off video. Sorry, I was trying to take you off Spotlight. So if we have members of the press on, Kerry, can they all unmute themselves?
I will watch for a raised hand and let them talk.
Okay. And we also, if people have questions, they can also type them into the Q&A. If you are not a member of the press, I'd like to ask if you can hold any questions that you have until members of the press have a chance to ask a question. So if we have any questions from the press, please raise your hand and Kerry will make it possible for you to ask your question out loud. Otherwise, people can use the Q&A function. Are we seeing questions from anyone?
I am not yet seeing any questions. Oh, I see one coming in. Eric Gunn.
Hi, I was going to just chat the question, but thank you for opening the mic. Can you speak a little bit about how the pandemic maybe what you're seeing as how it may be affecting the spiritual lives of your congregants and members and friends of your various faith groups?
From a Christian perspective, I might ask Sonja to speak to that because she's working in the parish at the moment. And then folks from other traditions, feel free. Sonja, do you feel like answering that for us?
I can do that quickly. It's a difficult time for all of us. I'll say that, that folks are really feeling the strain of this ongoing pandemic and how long it's going with no end apparently in sight unless we get things under control. But I also have found that this is a time where people are reaching for their spiritual depth and really taking stock of what is it that their faith, how are they grounded in their faith? What is it about their faith that is giving them the resources to move forward? And so in that way, although it's one of those kind of difficult growing times, I would say, where we have opportunity to really ask the questions that are important about what does it mean to be human beings and human beings in relation to God and in relation to one another and in relation even to creation as we see issues around that during the pandemic. So that just a challenging time, but also a time where I've seen people really prioritize their spiritual lives and go deep.
Leaders from our other traditions.
Yeah, I'll say something if that's okay. So I agree with Reverend Sonja that there's a lot of resilience. I also know that we just finished our high holiday season, so our most important holidays of the year where people gather, and it's sort of if people go to synagogue once a year, that's when they go. And I know that my Muslim colleagues and friends went through this during Ramadan, that celebrating communal holidays without being able to be together is really challenging and sort of highlights our separation. And I feel concerned about, entering the Thanksgiving and Christmas season when the majority of Americans will have their holiday time, their biggest holiday time, and the sort of isolation and loneliness that comes. And I think the more holidays that pass that we have to do in this manner, rather than hugging and holding each other and sitting together in pews, the more challenging it'll be to keep that resilience going.
Hi, I'll jump in as well. And like Rabbi Renee had also mentioned, the Muslim community really, it has been difficult. We're very community oriented. We have so many events that take place together as far as, gatherings, and of course the prayers 5 times a day that usually take place at the mosque. And so all of the mosques really around Wisconsin have been doing a virtual presentations, discussions, trying to keep the community engaged, but it's very difficult. And I think that the most difficult part was the beginning of the pandemic, when we had Ramadan. And for most Muslims, this is the first time probably in living memory that they could not gather for the community prayers together in the evening, the breaking of the fast in the evening. This is also the first time in living memory that the pilgrimage to Mecca was halted. This is unprecedented. But again, it goes back to the whole concept that the sanctity of life supersedes even worship practices that could put people's lives in danger. So we're working with that. I think this has also been a time for reflection. There are so many people that have said that actually, in spite of all of these restrictions, this was probably the first Ramadan that so many people felt it was incredibly spiritual to spend it all with family, at home, praying together, sitting with your children. So there are benefits, and it is definitely a time for people to think about their lives and the purpose for their creation and what they're doing for the rest of humanity. So we need to take a look at this as again a way to strengthen our faith and not and it has in many ways rather than affecting our faith.
I would like to comment that this is a test of our resiliency as human beings and our resilience as people of faith. Because as the Baptist religion, our institutions are mostly run on donations and offering tithes and offerings. So it has been a strain on the business part of it. But once again, I will say, would God want us to concentrate on the business of it or the humanity of it? Because this has driven us out of the doors of our churches into the streets and on the airways. So actually, we have gained more participation online than we did in person. So this is a way that I believe we're asked, are we doing church the way Jesus would want us to do church? Because during his time, Jesus never told anybody to build a church. He told them to be a church. And I think that the positive part of this is we're creating ways to connect with and to worship with people that we have not connected with before. So I think that us being pushed out of the doors of the church, out of our comfort zones, and into a more active role in humanity is probably one of the more positive things about this. If we can reach other humanity and convince them that this is a joint effort, it won't be over till it's over. And until we join together and fight this epidemic together, we are not going to make any headway. So we're still doing virtual worship. We're still doing very small social gatherings, and we're still praying for a glorious outcome that I believe is going to happen when we come together as humanity and decide that we are all connected.
Thank you. Do we have other questions from the press? Kerry, you saying anything?
Not seeing any more hands raised at this moment.
Then we can open it up to the rest of our participants if anybody has any questions. And if not, then we'll say good morning.
Well, while I have a chance, I would like to say I have to leave right now. But thank you for giving me this opportunity. Thank you for the invite. And I look forward to tomorrow when we continue this conversation.
Thank you, Reverend Brisco.
I am not seeing hands raised from the general participant list. So it looks like we are done with our question and answer portion, Rabbi Bonnie.
Okay, I do have a request from Eric Gunn, one of our, from the Wisconsin Examiner. If the speakers could please send me your headshots, that I can share it with Eric.
I can do that.
Great. So I will be after all of you for your headshots if I don't get them from you today, so I can send them out.
Yeah. If anyone who is on this call is interested in a recording, we have been streaming this live on the Wisconsin Council of Churches Facebook page, and that should be converted into a recording to view immediately after this live stream has ended. And later today, we'll also post this on the Wisconsin Council of Churches YouTube channel.
Great. Thank you all. Thank you to all of our speakers. Thank you to our participants for listening. And let's all stay safe, stay healthy, keep our families safe and healthy. And we will be in touch because, as Reverend Brisco indicated, this conversation is not over. So thank you all and have a safe and healthy day.
This program is a production of Wisconsin Eye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. Wisconsin Eye is the nation's first and only independently funded state civic broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.